All right, Brad, do you have pain on one side of your back? Not both sides, one side. If you
Yeah.
do, this might be a problem that you have. We'll go through it in great detail.
Excellent job, Bob. Once again, we're covering every base.
Bob and Brad, the two most famous physical therapists on the internet.
All right, Brad, this is based on the book The Ultimate Back Pain Solution by Rick Olderman. He's an older man. No, he's a physical therapist. And what he describes is when you get pain on one side, what happens is over time, there is some trauma to one side.
Sure.
This would be the left side, correct?
Yep, over
And,
here.
and what happens as a habit, you start leaning towards that side.
Sure.
Then after a while, these muscles tighten up the internal obliques, external obliques, and the latissimus dorsi.
What about the quadratus lumborum?
I could, yeah.
So we're talking about the muscles here. You can see the gap here is three fingers over here. We can get,
It's five.
yep. So everything just shifts towards the painful side.
Right. And what happens over time, now that it's chronic, is you're compressing the back on this side.
Sure.
So you're going to have more disc problems, more facet problems.
Yep.
Everything is enhanced.
And so these muscles are actually shortening and getting tighter.
Right. Very simple. So we're going to try to stretch them.
Right.
So the way to tell whether or not you have this is actually one way is to actually
Look.
look at the person. Right. Very good.
But so if we're going to look at Bob's shirt and he's going this way, these muscles and tissues are tight. You can see the wrinkles in the shirt. That's showing that. And over here, things are tight. And actually, you could see, if you imagine just his spine, it's curving over. You can see how I draw that there. So everything is this way. And actually, sometimes it's best to see this when you're maybe 30 feet away or farther away and you're watching someone stand or walk. Sometimes the distance allows you to see that.
All right. This next thing is a little more difficult, Brad. Why don't you bring your spine
come on,
over here?
Sam.
So you're going to go up and you're going to take your hands, your fingers,
Yep.
and you're going to dig them into the side of somebody you're checking on.
Yes.
So, and you're going to see if the pelvis is higher on one
Right.
side.
Right. Yep.
It's going to probably be higher on the side that's tight.
Mm-hmm.
Or you also check the rib cage. You go down and put your fingers underneath the rib cage.
And I got to admit, there's people, if you're not used to doing this, it's kind of hard to
I
feel
agree.
the bony prominence that you're looking for.
I agree.
But that's the way therapists will do it.
So I think, if you have one-sided pain, it's worth trying these stretches, even if you don't see the difference.
Right, right. And you're going to go by response. If it feels good, things are better while you're doing it, and
Right.
afterwards you
Exactly.
continue. If it creates pain, sharp pain, it's probably not the right avenue to go after.
Very good.
Approach. That's what I meant to say.
Approach.
Avenue. Avenue is the name of a road.
All right, these are very simple treatments, Brad. Anybody can do them.
Yep.
So again, if they hurt, don't do them. If they don't help, don't do them. So we're going to start with pretending my right side is tight. All you're going to do is put your arm overhead and walk with it stretched towards the ceiling. Now, I can actually touch the ceiling, but
I
Brad?
used to tell my patients, pretend you're reaching up to grab an apple, and you're reaching
There
for an
you
apple.
go.
It's just out of reach, and feel that stretch over
Adam
here.
and Eve.
Yep, and then if there's an apple tree, you can actually go try it, and then walk
And then
around
walk
the tree.
along. Yeah, very good.
So you actually stretch and then walk like that.
Right.
For how far?
They didn't say.
Yeah, it's going to be use your judgment.
Right.
It's probably not going to be for an hour, but a few minutes, possibly 30 seconds.
We'll go on to number 2 now.
Okay.
All right. On the second one, Brad, you're going to need a pull-up system or a pull-up bar or a tree branch or a rafter or something.
Something overhead.
Now, this happens to be our giveaway this week.
Right.
Um,
So it's our pull-up system.
Right.
That works real well. You do
with
need.
our wall anchor.
Yep, it comes with a wall anchor, and the nice thing about them is you can put them in and out extremely easy.
Yeah, it's very simple.
Yep, and the way they work is you grab like this, you face them all, and you simply do your pull-ups, and you can look at my hands. They twist and you're not fixed in like a pull-up bar. That's one of the big advantages.
Right.
For this situation, we're going to use this. You could use a pull-up bar, whatever, like Bob said, a tree, a rafter, and I'm going to stretch.
You only need one.
Yep, stretch the right side. Let's say this is my tight side, and I'm going to go down. And you may use the wall just to help guide yourself down.
Right, and an easier way
Yeah.
into it.
And I can clearly feel my right side, the muscles stretching. And then just gently go into it. Just don't hang there
And
aggressively.
Brad, while you're doing it, take some deep breaths. Very
Right.
good. 3 to 5 deep breaths, and that should be good. You
Yeah.
can do it throughout the day.
Yep.
All right, Brad, on the last one, you need a broomstick,
Yes.
booyah stick,
Yeah. Piece of doweling. Anything that's
right.
about probably 5 feet long for most people.
Yep, exactly. And what you're going to do is you can do this in a seated position. I'm actually going to put it on my chair or
Yep.
bench. I'm going to reach up as high as I can. And then I'm going to lean forward and really feel a stretch when I do this.
And you could actually go to the side. It might stretch the side a little bit better.
Good
You'll have
point,
to
Brad.
experiment with that. If you're using the broomstick, it'll work, but you might find the
It's
end
going
might
to slip.
slip or poke into the chair. So put a shoe there. Then you can put that piece of doweling or broomstick in there, and it works really well to protect and keep it from slipping. There we
Yep,
go.
that's Brad the engineer.
I just thought of a shoe. Yeah.
Again, some deep breaths while you're doing it. And again, if this is help, if it helps, keep doing it. If it doesn't, stop. Either way, it should take away your pain if it's helpful.
Right.
All right, Brad, we can fix just about anything.
Oh, except for,
A broken heart.
yes, and this is probably not going to,
You ever have a heart broken, Brad?
well, Bob, of course.
You don't want to talk about it.
No, it's a family show, and I don't want to get into the way I start talking.
It was a
about
sad thing,
it.
huh?
Oh, my
You start
God,
crying.
Yes. Be careful.